19-year-old Brandon is in trouble. Already at his young age, he has experienced homelessness as an infant, prison time as an adult, and diagnoses of Asperger's syndrome, a high-functioning form of autism, reactive attachment disorder, a failure to form bonds with his caregivers in early childhood, bipolar disorder, and schizoaffective episodes throughout most of his life. His adoptive mother, Bonnie, who asked that their last names not be used, said that the youngster is without a high school education, without medical insurance, and has rotated through 9 or 10 jobs in his short tenure as an adult. Brandon lives at home with his parents, but is looking to move into a place of his own in mid-October, and she is concerned for his future.
I'm worried about him because I don't know what's going to happen, but the stress has finally gotten to me.
As to whether Brandon will end up back in prison, Bonnie said,
30% chance, because his motivation is really strong not to go back.
Brandon's story illustrates some of the challenges faced by youth with mental illnesses once they age out of childhood mental health services. Complicating treatment attainment is the fact that many young people are reluctant to obtain formal diagnoses, and disorders of emotions and behavior don't fly in the adult mental health system. Rebecca Weisenbach, a certified rehabilitation counselor and counselor for transition at the Georgia Vocational Rehabilitation Agency in Athens, explains.
And a lot of kids don't want that. So they'd rather have the EBD because it's kind of general, They don't want the formal diagnosis of someone, maybe schizophrenic or whatever it may be. They're not willing to accept their disability.
Bonnie is cautious about reality for Brandon, but still sees hope for her son's future.
But I still love him a lot, and I still want the best for him. So I'll do what I can to help him out as much as I can. But he needs to be his own man, and I'm happy that he's trying to take those steps.
Sandra McGill, Graduate Newsroom.